Okay, so we've just entered our patient's room, and today we'll be performing a nasogastric tube insertion, feeding, and removal. So some indications for an NG tube would be if the patient needed suctioning of their GI tract, upper GI tract. This could be due to toxic ingestion such as alcohol or poisons, a bowel obstruction in the lower part of their GI tract, GI surgery, or upper GI bleeding that need to be suctioned. Now, some indications for GI or NG feedings would be if the patient had a dysphagic condition that caused them to not be able to swallow correctly, or if they were high risk of aspiration. All right, so first, before we begin inserting our NG tube, we will verify our physician's order to do so. Once we've done that, we'll come into our patient's room and identify our patient using an armband, date of birth, name, and after we've identified them, we'll then wash our hands, perform hand hygiene, and don our clean gloves. Now we've gathered our equipment here, and we will move our patient to high Fowler's position, unless contraindicated due to another condition. All right, so we will put our emesis basin in front of the patient on their lap and drape their chest with a towel. We would also be explaining this procedure to the patient to reduce any kind of anxiety levels or possibilities such as that. All right, so now that we have draped our patient, we will ensure that the nose, each nostril is patent by asking them to breathe out of each side. Okay, and they can breathe out of each side. And now we will get our NG tube. And we need to measure the length that we need to insert the NG tube. And we'll start by putting the tip of the NG tube on the tip of the patient's nose, and then measuring to the tip of the ear, and then to the tip of the xiphoid process. So it'll be about right there, which is 55 centimeters. All right, so next we will lubricate the tip of our NG tube 3 to 4 inches, and then we will insert into the right nair 55 inches, going all the way down to the stomach. Now we will provide our patient with ice chips or water to swallow while we are inserting, to ensure that we won't go into the respiratory tract. Now, while we were inserting, if there were any signs of coughing, dyspnea, or respiratory distress, we would immediately stop and take it out. But the patient tolerated it well. We made it all the way to 55 centimeters, and we are good to go. We can attach our NG tube to our suction and or feeding pump, whichever we were ordered to do. We are attached now and ready to go. Move that. All right, after we have inserted our NG tube and there were no issues with insertion, we would take a syringe and we would aspirate a small amount of gastric contents to ensure our placement of our NG tube. That's very important. So we've gotten a small amount of aspirate in our syringe. We would test the aspirate on a pH strip, and to see if it were the correct pH of gastric contents, which would be about 4. All right, our pH is correct, so we will then instill back any aspirate we had left in our bottle and a little bit of air to ensure that it goes all the way back in. After we have ensured that with a pH strip our NG tube placement, we would then order for a chest x-ray for the patient to be completely positive that the NG tube is in the correct place that it should be. All right, so after it has been confirmed that we have our NG tube in place, we will secure the NG tube permanently with to the patient's nose with tape, and going on the side of the nose and underneath, making sure that they could still breathe out of their other nostril, but ensuring that the NG tube is not likely to get pulled out or fall out or anything like that. Okay, and after we perform our NG tube insertion, we would take off our gloves, wash our hands, perform our hand hygiene, and we would document the patient's response, the procedure, the aspirate, the characteristics of the aspirate, how it looked, how much was taken out, and things like that. Okay, so after we have gotten our NG tube inserted, we have just gotten an order for a GI feeding, NG tube feeding. So there's a couple of ways that NG feedings can be administered. So the first way I will talk about is gravity feedings. So gravity feedings, you would connect a syringe such as this to the NG tube and hold above the patient's level of their face, of their nose, and pour the feeding into the syringe and let, as the name suggests, let gravity do the work and feed the NG tube into the patient. And once that would be done, the other method of performing a feeding would be to connect to a pump feeding device, such as we have here. Connect and make sure that the pump rate is verified and correct, and the pump formula is correct, and everything has been changed out on the hospital policies basis. All right, so that's the couple of types of feedings that can occur. Now, with each of those feedings, before you would initiate those feedings, you would, just as before, you would check for aspirate before you initiate. And if it is less than 250 milliliters, you'll be able to continue with the feeding. Now, if it were more than 500 or more than 250 and two separate aspirate checks, you would instill the aspirate back in and do not initiate the feeding, and mark in the chart that there was too much aspirate, and possibly alert the healthcare provider. All right, and also before you initiate feedings, you would be sure to flush with 30 mils of water into the NG tube to make sure that it's still patent and there isn't any complications with the tube, leakage, or anything like that. And you would also flush before and after. Okay, so we've had this NG tube in for a couple of days now, and it's time for the patient to be discharged and time for us to remove the NG tube. So we are still in high Fowler's position here, and we would come in, explain the procedure to the patient. We have our emesis basin here again, and the cloth draped over the patient still. All right, so we would explain everything to our patient, perform our hand hygiene, and don our clean gloves just as normal. Identify our patient, make sure we have the correct physician's order to remove the NG tube, and everything is up to date. So we're good to go, and we'll instruct the patient to take a deep breath and hold it as we take off the tape of their nose and use our cloth to gently but quickly remove the NG tube. We can wrap it up in our cloth here and drop it in our emesis basin. And we could then provide our patient with a different towel here. We can provide them with a towel to remove any leakage or mucus that would come out. We could provide nose and face, mouth care check and see if there's any skin breakdown underneath the tape that was there. And after we would remove our NG tube, we would monitor our patient, make sure that there's no respiratory issues that have just developed, any damage that could have happened from the removal of the NG tube, and our patient looks fine. So then we would remove our gloves, perform our hand hygiene one last time, and document everything that occurred, removal of the NG tube, when, what time we did that, how the patient tolerated the procedure, if there was any precipitating factors, such as symptoms that could have developed from the removal of the NG tube, and how the patient is after we removed it. All right, thank you.